Hi, my name is Megan Rossing and I am a cranial specialist here at Lifescape and Rise. Today we are going to review the wear and care instructions for your infant's new helmet. All of the information discussed in this video can also be found on your handout. First, let's discuss the schedule for your baby's first week in the helmet. We are going to gradually increase the time your baby is wearing the helmet using the chart on your handout until you get to the 22 to 23 hours on per day. The schedule is meant to allow your baby's skin and temperature regulation to adjust over 5 days, so do not increase wear time faster than this, even if your baby is tolerating it well. On day 1, your baby will follow the hour on, hour off schedule all throughout the day. You will not use the helmet during naps or bedtime during day 1. We recommend disrupting your child's sleep schedule as little as possible during this break-in period. For example, if your baby has been wearing the helmet for 30 minutes, but it's time to take a nap, take the helmet off, allow your baby to have a full nap, and then put the helmet back on and restart your hour once they are awake. On day 2, you will increase to 2 hours on and 1 hour off all throughout the day. On day 2, you have the option of using the helmet during naps, but your baby will not wear it to bed. On day 3, you will increase to 4 hours on and 1 hour off all throughout the day. You will use the helmet during all naps on day 3 and try for bedtime. If your baby sleeps through the night with the helmet, you do not need to take it off after 4 hours. If your baby does wake up, we recommend trying whatever you usually do to get them back to sleep, such as feeding or rocking. If this works, continue to use the helmet. If your baby is struggling to get back to sleep, take the helmet off and push a little harder the next night. Note your baby's temperature and sweatiness in the helmet and make any clothing adjustments as needed. On day 4, you will increase to 8 hours on, followed by an hour break, wearing during all naps and trying to keep it on throughout the night. Again, if your baby wakes up the second night, try whatever you usually do to help your baby get back to sleep. Monitor temperature and sweatiness to make sure this is not impacting your baby's ability to sleep. By day 5, you should be in the helmet for the full 22 to 23 hours on a day with 1 to 2 hours in breaks. Some families choose to take a short break while getting ready in the morning and a longer break at night. Some use short breaks during feeding to avoid having to clean food out of the helmet later. The goal is to be in the helmet a minimum of 22 hours per day. The helmet will not be worn if your infant has a fever of over 100 degrees or during baths or swimming. At some point during your time off, you will need to wash the helmet every day. Cleaning the helmet typically takes only a few minutes with a few additional minutes to dry. If your baby does not currently take a bath every day, it is recommended to continue with their current bathing schedule. This will help avoid drying out your baby's scalp. If your baby does not wear the helmet for more than 48 hours, you will need to restart the wear schedule at day 1. Excessive time out of the helmet not related to illness may create problems with the fit of the helmet because the head continuously grows. Lack of recommended use or early discontinuation of treatment without practitioner consultation may result in less than optimal correction of head shape. Please review the wear and care sheet for additional information not provided in this video. Contact your cranial practitioner if you have questions or concerns so that any issues can be resolved quickly.